Today, we have one of the stalwarts of functional medicine, especially in India, Dr. Ashwani Garg. He is one of the founding member of IAFM, that is Indian Association of Functional Medicine in India. So here, he is actually going to share some thoughts on functional medicine. What exactly is functional medicine? This may be a new term for you. Let us hear what exactly is functional medicine from the words of Dr. Ashwani Garg. Hi, doctor.
Thank you, Dr.
So, can you please introduce about you at the outset?
Right. So, I'm a conventionally trained medical doctor and started my practice into functional medicine. I think reason that all of us as doctors want to do best for our patients. We want to see how they can get more healthier, rather we keeping them diseased. Right. This is where the functional medicine comes into picture, where we want to bring them back to the normalcy. Right. So what is functional medicine? It's just a way to understand why anybody gets unwell. There has to be a reason why we all get into sickness. There has to be a reason. Functional medicine is all about knowing what is wrong in the body by doing an objective assessment, by doing a lot of thorough assessment, testing, so that we understand what are the reasons happening in the system which leads to a disease. For example, diabetes, by definition, it means high blood sugars. Now,
Yes.
there could be 100 reasons which can trigger high blood sugar. Now, when we do a conventional medicine treatment for blood sugar, we want to bring it down by hook and crook. We can do metformin, with glimepiride, or maybe insulin, whether it's required or not required. But if we, from a functional perspective, we want to see why this guy is high on blood sugar. It could be stress that is causing blood sugars. It could be their metabolic function is poor, because of that sugars are not getting consumed in the mitochondria, because of that sugars are keeping high. It could be some level of chronic infections in the body which is affecting the mitochondria, which is keeping the sugars high. It could be some toxicity in the body, could be heavy metals, which is affecting the machinery, the metabolic machinery, mitochondria. That function is not happening because sugars are keeping high. It can simply because I'm eating too much food.
Wow.
Okay.
Yeah.
It can be if I don't get under sun and always under tube light screens, then also my metabolic function can happen. Because of that, mitochondria is not doing okay. Because of that, blood sugar can be high. So it can be very, very simple. I am not repairing my body at a speed which is the damage is happening. So if damage is more in the body, repair is less, more damage, effectively I lose my mitochondria. Number of mitochondria in my each cell is reduced. As a consequence, my burning machinery is reduced. Consumption has come down. The blood sugar goes up. So you see, functional medicine is trying to understand what are the reasons why somebody's blood sugars are keeping high, rather than symptomatically just want to fix it. We want to fix the problem.
So that's the exact difference between the conventional system of medicine and functional medicine, what I understood. Say, functional medicine per se, it will be looking after the root cause of the disease. As you said, the conventional medicine are actually looking for the symptoms of the disease. Am I right?
That's right. For example, now even if we expand the analogy of this blood sugars, first line of treatment if somebody's blood sugars goes high is metformin, which is improving the metabolic function, which is okay. Second is they add another drug which can increase the production of insulin from the pancreas. Whether insulin is already there or not, without knowing that, we add a drug. Now, if that still does not work, I add another pancreas insulin in the injection form.
Yeah.
You see, my goal is somehow bring it down, whether reason of the problem something else. So here in functional medicine, type 2 diabetes by definition is a high insulin case. In that case, increasing insulin or injecting insulin can be very, very counterproductive. And a lot of people can get into type 1.5 diabetes if we don't do it right with them. So it is very, very important we take each individual case, evaluate each case, first define how much is the problem, what is the problem, and accordingly we do the treatment.
Wow. So, doctor, what exactly is the scope of functional medicine? When I am asking this question, each and every different pathies, that means homeopathy, Ayurveda system of medicine, naturopathy. As an integrative therapist, I believe that each and every system has its own role and its own scope. So, where do you allocate this functional medicine aspect or this system of medicine? So, what exactly the scope in terms of disease curing,
right,
or actually preventing the disease also?
Right. So at least now we are on the same page. A disease happened because of something else which is wrong in the body, which is called epigenetics.
Yeah.
Genetics has little role. Epigenetics has a much bigger role to play behind all the chronic problems our society is going through. So at least people will also understand that we are not born with the problem. Somebody gets diabetes at the age of 40, somebody gets a rheumatoid at the age of 30, somebody gets some other disease at the age of 60. We cannot call it a genetic. Yes, we have been saying that, but which is very, very untrue. The truth is epigenetics. Now we know epigenetics are the factors which is leading to the massive increase in the disease. Now, homeopathy, Ayurveda or other streams of alternate medicine are basically using the intelligence of this body to get better. Allopathy primarily is somehow tweaking chemical imbalance, this thing to get to some, not always the right way. Maybe they're able to change it. Now, functional medicine is a more advanced form of allopathy, let's put it that way. We use the most advanced testing to see. And when it comes to solutioning, when it comes to what kind of different solutions to be given to each person, we can take a little bit from naturopathy, we can take a little bit from allopathy, or the concept from them, and testing aspect or the very deep analysis during objective assessment we can take from the allopathy. So that way it covers takes the good part of all of these things. And that makes it a more valid and more objective approach, which can really, all of us are today logical people.
Yes.
We want to see the data.
Yeah.
What is wrong? And if data is with me, this is wrong with my body, and I work on these parameters, and there's a good reason that I can get well. If I go to a doctor, I just have to trust them.
Yeah.
And hardly I'm given any reasons why I'm sick. Then getting well becomes more difficult. So when people come to us, we give them the reason, what is wrong in the system, and this is the step-by-step approach they have to follow. The mind is convinced and body works.
Wow, that's great, doctor. So, doctor, you talked about the different tests that you are using in functional medicine perspective. So, tell me a little bit more about what are the usual tests that a functional medicine doctor used to check with their patients, whether it is similar to the conventional medicine blood test like your complete blood count, HbA1c, blood sugar level. Is it the same way or something different in functional medicine when it comes to blood tests or any other biomarkers?
Right. So, lot of the tests are conventional tests which are used by most of the doctors, and we are also using it. That yes, we can interpret more information from the same test. That is one. Then usually we go a little more deeper when it comes to blood test. For example, if anybody comes to me with diabetes, I want to know what is the thyroid function, I want to know the immune status, I want to know if liver is doing okay, I want to know if nutrition is enough in the body or some deficiencies there. I want to know if any infections are there. I want to know how the cell is functioning for them. What is the metabolic function, organic acid test that is there. Then in some cases, to know the tissue toxicities, we also do a hair mineral assessment. What is
hair mineral assessment? Okay.
So that way, most of the common tests they're regularly available, plus little more advanced tests which are unlikely used by the conventional doctors. But then this gives a data set to define what is our problem. When we know how much is the problem, then it becomes easy for us to work upon that.
Say, let me put this in another way. Say that if a patient comes to you with a diabetes, the conventional doctor used to check their HbA1c, FBS, etc. So you're going a little bit deeper about their liver function, their thyroid function. So how exactly these kind of biomarkers helping in treating in a functional medicine way
Right.
a kind of diabetic patient?
Right. So I mentioned blood sugar could be high because of toxins, because of infection, because of deficiencies, because of liver not doing a good job, because of cell function is impaired. Okay, so there could be so many a number of reasons why, because blood sugar is keeping high. Until I know what is the reason, it's very difficult to solve the problem. So once we go a little deeper, it help us where we have to make these corrections.
Okay, I got it. So from these biomarkers, you will get an idea what exactly the root cause is, not the symptoms or signs.
That's true. That's true. So it's a whole root cause based approach. Maybe we want to sort it out.
Yes.
What is causing the problem?
When it comes to the practice of functional medicine, when we check with the different systems of medicine, they have their own pharmaceutical methods in preparing drugs. Is there any prevalent mechanism of preparing such drugs in functional medicine, or the functional medicine doctors used to suggest suggest the medicines which are from the conventional source only? How come the prescription of drugs that's actually happening in the functional medicine sphere?
Right. So in functional medicine, we have adopted different tools for the right use.
Okay.
For example, if I have to give nutrition, I might choose nutraceuticals, which is good quality, straight away nutrition to the body.
Yeah.
Now, that can also come from, let's say, herbal powders.
Yeah.
But quality becomes an issue. But generally, nutraceutical manufacturers are good quality and they maintain high standards. Now, if I have to deal with infections, now there are two ways of dealing with infection. One, of course, we have to clean the infections. I have to do antimicrobials, antifungals, antiparasitic, etc. For that, I can use herbs also. I can use a little bit of allopathy also in a right way.
Okay.
You know that you have the best of the tools in your hand, but if you don't know how to use it, it can be a problem. Then alongside antimicrobials, we can use probiotics. Probiotics come in handy.
Yeah.
Now, if heavy metals are there in my body, how do I remove? Either I feed a lot of nutrition, as a consequence mitochondrial function gets enhanced, as a consequence body start excreting them out. But in some cases, when some genetic SNPs are there, body finds it very, very difficult to expel these toxins out. Then you might need some chelators.
Chelators.
Yes. So DMSA and EDT are too commonly used. Now that way, our job, depending on the severity of the problem, depending on the age of the patient, depending on the biomarkers, we can choose the right tools. Either it can come from different existing therapies or from nutraceuticals. That is what we do.
So you're saying that the tools for treating diseases comes from different schools of thought. That means whether it can be Ayurveda, whether it can be nutritional medicine, whether it can be homeopathy also, even from the conventional allopathic medicine also.
That's right.
Okay, doctor. So tell me about the future, what you are actually seeing in India, especially in a country like India, for functional medicine.
Right. So I think one factor, you and me both realizing that today patients are becoming more and more aware about their health. And they no more want to be managed with the disease. They want to come out of the disease. So this disease management model is not suiting them.
Yeah.
Right? They want to be healthy. If I get diabetes, I want to come out of that. At least that is a lot of people want it. At least that is driving this industry. Right? Now, when we understand this is my problem, and I'm given enough reasons behind it, why it has happened, then any logical mind will stick to it. But today all Indian people, for example, IT crowd, they're all data guys.
Yeah.
They need data.
Yeah.
So that way, it's a very, very perfect and right suitable remedy for people who really are concerned about their health and want to take charge of their own health. So that we give them the right tools, we give them the right data, and we give them the right follow-up for them. So that slowly, gradually they come down. So that way, I am of the firm opinion, eventually the so-called functional medicine, which is alternate today, will become mainstream or close to mainstream in the next 5-10 years.
Wow, that's great, doctor.